Hello everyone, welcome to the Smart RN channel. My name is Henry. Today we are looking at the management of acute kidney injury as well as the nursing interventions when you care for patients with acute kidney injury. So one thing I just want to remind you is that acute kidney injury is reversible. When we address the causes of AKI in a timely manner, we can be able to restore our kidneys back to normal function. So what are some of the methods of managing AKI? One, we have medications. We use medications when managing AKI, and among the most important medications that we use are diuretics. Diuretics are those medications that help us to have a high urination rate. So we pee a lot to try and clear the fluid from our body. So loop diuretics, for example, like Lasix or furosemide, and osmotic diuretics like mannitol are used to help clear the fluid from our bodies. Remember, we say that AKI patients have edema. They swell in their ankles, in the legs, in the face. This is because of fluid accumulation in the body. So we use diuretics like Lasix or mannitol to clear this fluid from the patient. The number two, we also have nutrition. Via nutrition, we perform things like sodium restriction. We restrict the amount of sodium that these patients can actually take. Remember, we said that water follows sodium. So if they have a high sodium intake, then we are going to have high fluid accumulation in the body, and that is exactly what we are trying to prevent. So there is sodium restriction. And then we also have potassium restriction. Remember, kidneys are the ones that clear potassium from our bodies. Now, because they are injured, we have a risk of potassium accumulating or getting elevated in the bloodstream, and this becomes very dangerous to the performance of our hearts. So we are going to restrict the amount of potassium that is taken in by this particular patient. Then we also ensure that these patients have adequate carbohydrates. And this is one, to strengthen them, and number two, to prevent the catabolism of protein. Because if proteins are catabolized, then we are going to have an increase in nitrogenous compound. So we ensure adequate carbohydrates to prevent protein catabolism, and this will help to decrease nitrogenous compounds in our bloodstream. Remember, the nitrogenous compounds are the ones that are cleared by the kidneys during filtration. So because the kidneys are injured, we have a risk of accumulating them in the bloodstream if we do not take caution. So we ensure adequate carbohydrates to prevent catabolism of protein. And then number three, we also have dialysis. We can perform short-term dialysis to allow the kidneys just to recover. Dialysis is that process through which blood is moved out of a patient and passed through a special filter that removes the waste or the waste product before that blood is directed back to the bloodstream. So we can perform short-term dialysis to help our kidneys to recover. And when is dialysis indicated? Dialysis is indicated especially when you have volume overload, when these patients have a high increase, a high accumulation of fluid in their bodies, when you have elevated potassium in the bloodstream, hyperkalemia, when you are experiencing metabolic acidosis, altered mental status. Remember, the accumulation of waste in the bloodstream can cause our patients to be altered mentally. So when these patients have altered mental status as a result of the accumulation of this waste in the bloodstream, then we indicate dialysis. We can also indicate dialysis when we have got cardiac tamponade. Cardiac tamponade is when we have got fluid accumulation in this can interfere with our heart's performance. So in those cases, we indicate dialysis to try and clear this particular fluid from the bodies of these particular patients. Now, what are the nursing interventions when caring for patients with acute kidney injury? Number one, we have assessments. So we are performing continuous assessments during treatment. And one of the most important things that we pay attention to is the blood pressure. Remember, we saw blood pressure as one of the perennial causes of acute kidney injury. So initially, the blood pressure is low before acute kidney injury. But then when we start having accumulation of fluid in our bodies, the blood pressure tends to increase. So we are paying great attention to this particular blood pressure. We are also assessing edema. Remember, these patients have got swollen ankles, they have got swollen legs, others have got swollen faces because of accumulation of fluid. So we keep an eye on that edema. Is it improving or is it getting worse? So this helps us to direct treatment. Then we also continue to assess the mentation. Remember, we have said that accumulation of waste products in our bloodstream can cause the patients to have altered mental status. So we are also assessing their mentation just to ensure that the treatment methods are being effective. The number two, we also monitor the input and output. We monitor what these patients take in and what they take out in form of fluid. So we perform fluid restriction. Normally, providers will restrict these patients to 2 liters fluid, 2 liters of fluid per day, or 1 liter of fluid per day, or 1.5 liters of fluid per day, based on the severity of their problem. So we help to monitor the input. How much are they taking in and how much are they taking out? Because that can have, that has a direct impact, or that has a direct bearing on the kidney performance. Then we monitor the lab values. We are monitoring the lab values just to determine whether our treatment methods are being effective. So we keep an eye on things like the BUN, we keep an eye on the creatinine. Remember, we said the creatinine is the best indicator of how well the kidneys are performing. We also keep an eye on the potassium levels, the hemoglobin, and the hematocrit. Remember, the kidneys are injured, so erythropoietin is not being released as it should. So we have an effect on the hemoglobin and the hematocrit. We also check the sodium levels. We keep an eye on the calcium levels, which tend to be low because calcium is not being absorbed in the GI tract. Remember, the kidneys are the ones that activate vitamin D for calcium absorption. On the other side, we are also checking on elevated phosphorus levels because phosphorus has an inverse relationship with the calcium. So when calcium goes down, the phosphorus goes up. So we are keeping an eye on this particular phosphorus value. Nurses also administer medications. There are medications which are going to be prescribed by the prescribers. So it is the nurses who are going to ensure that these medications are administered on time, and especially the diuretics, which are used to clear fluid from these patients. We also monitor daily weights. We are weighing these patients. Remember, fluid accumulation has a direct bearing on our weight. So we are weighing these patients daily to see whether their weight is the same, is going high, or is going lower. So this will have or will indicate to us the effect of our treatment method. So we normally weigh these patients, and especially in the morning, we weigh them on the same scale, we weigh them in the same clothing, just to ensure that we are getting accurate reading. We also enforce the diet restrictions. Remember, we said the patients are going to have sodium restrictions, potassium restrictions, so we ensure that those diet restrictions are adhered to. Nurses also help in positioning of these patients, ambulation of the patients, cough and breathing exercises. Remember, we might have fluid that accumulates in the lungs, and this may affect the breathing way of this particular patient. So we have to position them, we have to ambulate them, we have them to perform cough and breathing exercises to try and deal with that particular problem. Then we perform, or nurses perform, patient teaching. So what are they teaching? They teach patients the acute kidney injury causes, they teach them the diet and fluid restrictions, we are teaching them about medication compliance, we are teaching them the importance of weight monitoring, and even monitoring the urine output. So these are the teaching that nurses will actually give to these particular patients as they try to deal with this particular acute kidney injury. So that brings us to the end of this video. As always, drop a comment, like this video, share it, and if you are not a subscriber, I request you to subscribe to this channel. From me here today, it is a goodbye.